Okay, let me know when you're good to go. Okay. So I have a couple of matters to address today. Firstly, we have seen a number of jurisdictions announcing that they are lifting their mask mandate on public transport. Queensland will be doing this as well from midnight tonight. That means that the staff and patrons on public transport will no longer be required under a public health directive to be wearing masks. However, I ask everyone to respect people's individual rights to feel safe and to wear masks when they feel it appropriate. And also, of course, there are still directions if you are someone who has been isolating after your 5 days, that you are requested to wear a mask for a period of time as well, and you also may be a close contact. So we certainly encourage those people to be wearing the masks, and those who feel they need to for safety reasons, and particularly if they're in that vulnerable cohort, to continue wearing those masks. The other thing I wish to talk about today is an extremely serious matter. As we know, there is a commission of inquiry being undertaken by Commissioner Walter Sofronoff KC right now into the forensic and scientific services here in Queensland. And I want to acknowledge, as I did when we announced this commission of inquiry, the work of the media, and particularly Hedley Thomas, in relation to raising this really important issue, resulting in this commission of inquiry being established. As was in the terms of reference, the Commissioner had the ability to issue an interim report. And on the 15th of September, Commissioner Sofronoff provided us with a redacted report that goes to the statements that are provided to courts in relation to certain DNA samples. In this interim report, what the Commissioner has found is that where work was ceased on the automicron process for priority 2, which is major crime casework, and resulted in an exhibit result of certain statements that stated either DNA insufficient for further processing or that there is no DNA, that those statements provided to the court are incorrect. They are not accurate statements, because those findings are only as a consequence of not further processing those samples. If those samples had gone on to further concentration, as was happening before 2018 and as has been happening since June 2022, there is a likelihood that some will find either partial or full DNA. So the statements, by not having that clarifying fact that the reason why there's no DNA or insufficient DNA, without stating that it's because they haven't been further processed, means that those statements before the courts are false. This is extremely serious and can lead to the potential of miscarriage of justice. Now, the Commissioner gave many stakeholders and legal stakeholders the opportunity to comment on these potential recommendations before issuing this report. There are some stakeholders who believed that it would be inappropriate to release these recommendations at this point, or at all, or at least wait until the final report. But the Commissioner's views were that if there is a potential for miscarriage of justice, we should not wait another day. And that is why the Commissioner provided the government with the report. Now, the Commission has not released this interim report. The Commissioner provided it to the government. The government considered this today at Cabinet, and we have immediately released this report. It is now publicly available for everyone to read. Why have we done this? For the same reason that this report was provided to government. If there is any potential for miscarriage of justice, we have a responsibility to the people of Queensland to do everything possible to address that miscarriage. What the recommendations, there are 3 recommendations in this report. go to correcting these statements before the court in both the two types of scenarios I've talked about. And the third recommendation goes to making sure that we are properly resourced to achieve that goal, and that work should start immediately. We adopt those recommendations in full. It is important that we correct every one of these statements to make it clear that there is either no DNA or insufficient DNA on the basis that there was not further processing of those samples. But understanding the significance of what we are doing here, the government, myself as the Health Minister, made the decision to take this further. We are not just correcting statements before the court. We are going to identify every sample that falls into the priority 2 group that fell within the range that is prescribed, which is the 0.001 and 0.0088 nanograms per microlitres. Every sample that was not further processed between 2018 and June 2022, we will work with QPS to identify those samples and have them progress to the further processing. I expect that some will show partial or full DNA. We have no idea the number of samples yet, and we don't know how many of those will show sufficient DNA to warrant further consideration by QPS. That work will be undertaken as a matter of urgency. But what we do know is even if there's one, just one case, one victim, one alleged perpetrator, where the DNA shows a connection, either partially or full, to someone involved in a crime, then we have a responsibility to act and provide that person with justice in whatever way we can. And that is why we will undertake this work. We will work in conjunction with the Queensland Police Service, who are the custodians of the database for those samples and the owners of those samples. The samples sit with FSS but are owned by QPS, and work with QPS as to who will undertake that further testing, how quickly that further testing can be done, and importantly the prioritisation of that testing. Because it is important that we prioritise those cases that are ongoing cases currently open before the courts. As I say, we will test all of them, but it is important that we prioritise those that are currently before the courts. We understand this will be traumatising for individuals in the community who have been involved in serious major crime. There is a hotline that's been established by the Queensland Police Service. We are working with the Attorney General's Office and the Department of Justice and Attorney General and the Queensland Police Service to ensure that we not just brief, but we continue to consult with the key stakeholders, including sexual assault and victims of crime organisations, to work our way through this process. But we're not going to hide from the fact this needs to be done. We as a government accept these recommendations. I find these personally shocking, these findings, and we have to do everything possible to ensure that justice isn't just seen to be done, but is actually delivered for the people of Queensland. I'll now ask QPS to just talk about the hotline that is now operational. And of course, we have the Acting Attorney General, Minister D'Ath here, and the Acting Police Minister, Minister Ferner. And I'll ask Minister D'Ath to say a few words as well, and then I'm happy to take some questions.
Good afternoon, everybody. My name's Marcus Hill, Acting Assistant Commissioner. As the the Health Minister said, we've set up a dedicated task force to work with Queensland Health to work through a considerable amount of data and victims to get a really good understanding of what we're dealing with, and then to prioritise those samples for later testing. Now, to help anybody who feels that they, as a victim of crime, that their sample may fall into the category that we're talking about here today, there's two ways that our victims can contact the police. The first is through our forward-facing website, so police.qld.gov.au. It will take you to a link where you can lodge an online form. Secondly, we've set up a dedicated hotline. So if victims would like to ring 1300 993 191, that's 1300 993 191. That will put them in contact with somebody who can help them and refer on their inquiry, and then we'll get back to them as soon as possible. Thank you.
As you've heard from the Minister for Health, I'm Acting Attorney General. I'd also like to acknowledge that the findings in the interim report are likely to be extremely traumatic for victims. Public confidence and reliability and transparency of our criminal justice system are paramount. That's why our government announced this comprehensive commission of inquiry. That's why the government has taken the decision to immediately release the interim report, and it's why we are taking swift action. We absolutely understand the seriousness of this, and can I say from the outset to victims that support is available. I'm advised the Department of Justice and Attorney General is working with relevant services to make sure that they have the support and the information that they need to respond and to support victims. We know that Queenslanders must absolutely have confidence in the justice system. In respect to existing matters, I'm advised that if a matter has or is going through court, the Director of Public Prosecutions is actively working with the Commission of Inquiry, and these matters are being assessed on a case-by-case basis. For cases where a charge has not yet been laid, this of course is a matter for the Queensland Police Service to determine. And I understand that the Acting Minister for Police will be able to address those matters.
Before I do take some questions, I should say that there's been a task force set up by the government, both in Queensland Health, and there's been a task force set up by Queensland Health and the Queensland Police Service. These were set up back in August to oversee the requests made from the Commission inquiry, but also to work on any implementation of recommendations. But the government wants to make sure we get this right, and that's why we are also appointing Professor Frank Gannon, who is certainly well known to the research community through his work with QIMR, but in many, many roles, and is highly regarded. He will be appointed to independently oversee the implementation of these recommendations and the identification and the testing of these samples and any referral that goes back to QPS. So once the testing is done and there is identification of any DNA, they will be referred back to Queensland Police Service to then assess what may or may not be done with those samples. Understanding that although a sample may show that there's partial or full DNA, there may have been other samples, there may have been other evidence in those particular cases such that this outcome will not have any sort of consequences to the final results in relation to any proceedings. But it is possible that these could change the outcome of proceedings, and that's why it is so incredibly important that we release this report, that we get on with this work, that we identify these samples as quickly as possible, and we get them tested and know what the results are. Questions? Look, I am very mindful that the Commission of Inquiry is ongoing. This is an interim report. The interim report states that there isn't a finding in relation to the reasoning why the methodology was changed or who was responsible for that at this point. The purpose of the report is talking about the evidentiary statements made for the courts. So I am respectful of the Commission of Inquiry process, that there hasn't been any findings in relation to any individuals and their actions at this point. And I await that final report that is due on the 13th of December. These are very serious issues. I want answers. The government wants answers. And I have no doubt that Commissioner Sofronoff will leave no stone unturned to find out how this has occurred. I do. I believe that the information that's being made available to me, we have sufficient oversight to know what is occurring. But, like any minister, I trust the advice that's been given to me. But these are concerning. I want to know why the methodology was changed. I want to know who authorised it. I want to understand the reasoning behind it. But importantly, the reports around the percentage, and this interim report will say that it appears that if these sorts of samples are taken to the next stage and further processing, there is a likelihood around 10% will end up finding partial or full DNA. That's an extraordinary amount. So I am interested in knowing why the decision was made to not further test and to change the methodology in 2018. I have confidence now because we changed that methodology back and every sample is now going on to that concentration stage. That has been happening since June 2022. So that's why I can have confidence that the samples are there, they're being tested. But there is more information to come out in the inquiry. And if that changes, I will act on that advice.
During all of those months when the government was resisting calls from lawyers, scientists and victims for a public inquiry, you repeatedly talked about the confidence that you had in the lab and the scientists working there. Do you maintain confidence in the managing scientist, Catherine Allen, and the team manager, Justin House?
Well, there's been no findings in relation to any particular individual. I am satisfied that there is sufficient oversight happening of FSS right now and that the testing is being done at a level that we expect as far as that methodology. That's my priority right now. We need to ensure that this work continues and that's what we're making sure is happening.
We just mentioned resourcing as an issue back then, though, and that must have played into some of the decision making.
Well, again, I'm waiting to get all of the evidence and the final report as to what the reasoning was for why the methodology was changed.
How many resources will you be giving to help?
So we are looking at what resources are needed. As I say, we've set up the task force to oversee not just the implementation of the recommendations, but importantly, all of the inquiries and information that the Commission of Inquiry is asking for. So there is a significant amount of information and data that the Commission of Inquiry has requested from SSF and Queensland Health, and we have set up a task force to make sure that we can provide that in a timely way. As far as resources for testing, well, again, that will depend on who does the testing. So FSS can do the testing, but the data and those statements sit with QPS. So QPS would have to authorise FSS to do that further testing or authorise some other lab. Now, there are only public labs in Australia. So it would have to be another government agency in another jurisdiction who did that. And we'd need to satisfy ourselves that they could do it in a timely way and that they have the capacity as well. So we are certainly bringing extra staff on anyway into FSS to help with that workload. But first, we've got to get this first body of work done, which is identify all the statements and identify how many samples there are and then figure out who does the testing and then we'll know what resources we need, but we will make sure the resources are made available.
Does the government anticipate legal action from in future?
Well, look, we just can't answer that at this stage. We've still got an ongoing commission of inquiry. We still have to identify these statements. We still have to go through those samples. So, I don't want to predicate what may or may not happen in the future on any of that. Let's wait till we go through this process and also the final report during this. Well, look, I think the scrutiny that's happening across FSS now is at a level that's never been seen before. So we have certainly from the Director General down scrutiny of the practices of SSF. We've changed the methodology and we have this task force set up. I have the Chief Operating Officer here, Dr Rosengren, as well, who I'm happy to pass to, who may expand on that. But we are doing everything we can to ensure that the public has confidence in the testing that we are delivering for Queenslanders. Yeah, look, I'm being told weeks to just identify the number of statements and the number of samples. So I'm hoping, but I don't have a definitive date yet. I'm hoping that we have all of that information and have exact numbers within a month, but then how long it's going to take to further test all those samples. We need to look at the lab's capacity. We need to look at which lab's going to do that testing. So first we have to get the numbers before we can actually look at who's going to do the work.
Just to clarify, despite the findings, nobody at the lab, nobody in management has been still signed while this inquiry is underway?
No, not that I'm aware of.
Are we in uncharted territory? Have you ever heard of this happening anywhere in the world?
Look, I can't say anywhere in the world, but I'm not aware of something like this happening nationally. I am very concerned. The public have a right to be concerned that statements have been provided to courts in which the jury, in which the judge, in which the defence didn't necessarily have full awareness that when there was a statement saying no DNA or insufficient DNA for processing, that there may very well have been DNA found if it was taken to that next stage. That's extraordinary.
And these are from forensic scientists who make those statements.
Yes, so there was an agreement, as I understood, that this would be the language written on these statements when they adopted the new methodology in 2018. Why they chose that, there is some of that covered in the interim report. All of those individuals were given the opportunity to give their reasonings and to comment on whether the Commissioner should or shouldn't recommend these statements be corrected. So that is in the interim report, but I'm very mindful that this is an ongoing inquiry, and I am going to try to limit my comments to the recommendations I'm finding in this report and not in any way influence what may still come out through public hearings and further inquiries.
The report also talks about thresholds in other states, and do you become aware that most other jurisdictions don't actually have a threshold for major crimes?
Well, it talks about all different thresholds, it doesn't say that they don't have that. There is different thresholds in different jurisdictions. I think what is important here is the way that the statements were reported. That's what is critical here.
States having no threshold, BT, WA, New South Wales.
But it also talks about how they deal with certain thresholds and whether they go on to further testing, who makes those decisions for further testing. As I say, there isn't a finding, and the Commissioner has made a point of saying in this report, this is not looking at why they made the decision, who made the decision, and whether it was correct or not. What this report is about is the statements that were issued were not accurate. Were not accurate in relation to whether in fact DNA did exist or not if the samples were further tested.
And you become aware of what Queensland's threshold was for testing in those major crimes
Well, when this issue started getting reported late last year, and I made comments at the time that talked about the advice given to me from SSF and the range that they used. What I wasn't aware of was what is further the information that came out of the task force from Margaret McMurdo that led to us initiating this commission inquiry around the QPS and further testing. What I certainly wasn't aware of until this interim report came out is that it isn't 1%, it is more like 10% of samples are likely to lead to partial or full DNA. That is an extraordinary number, and I am very eager to understand why this methodology was suggested in the first place. And you know, again, I don't want to in any way influence or interfere with the current inquiry and what still may come out through that process.
What's your message to
So there's a QPS task force and then there's a Queensland Health task force, because we're each getting, invitations from the Commission of Inquiry to provide data and information and evidence and documents. So we are all going through our own processes to do all of that. So we've got our own task force, but in addition to that, we have an interdepartmental committee set up, which is the Department of Justice Attorney General, QPS, and Queensland Health, all working together and collaborating on this. And we will certainly need a lot of collaboration on this because we will need to work with the stakeholders. Queensland Health's role is about the testing and the correction of those statements. QPS is providing approval to get those tests done, and importantly, what do they do with the results that come out of that, and with the Attorney General's role, of course, working very closely with the courts and the stakeholders as to what this means as far as all of those cases that might be found.
What's your message, Peter?
The wording that is used in this report is that the statements that forensics made was untrue. And if those statements were presented to the court that would reinforce the information, is it, in your view or your understanding, that there might be, criminal offence or legal ramifications due to this?
Well, certainly that's not for me to comment on at this point. There is still the inquiry ongoing. There is no finding in this interim report that they have deliberately misled the court or there would be any criminal offence related to that. But I'm not going to, again, deal with hypotheticals of what may come out through the ongoing Commission of Inquiry. Right now we're dealing with the recommendations before us in the interim report, not the final report, the interim report around the evidentiary statements, and also the decision of the government to take that further and do this further testing on the samples. Well, that's what the Commission of Inquiry is going to find out.
After reading the interim findings, very glad there was a commission offence of
Oh, look, hindsight's a wonderful thing in any job, and can I say, if I had had the information that I have now, the information that we became aware of through the task force and QPS's further request for further analysis of these, I have no doubt we would have initiated this sooner. We, like any government, acted on the advice we had at the time. But I'm glad that we are in a position to be able to act on this advice very quickly. It was the government that established the Commission of Inquiry. We have released this interim report, even though there wasn't a request to do so. It is the government releasing it, not the Commission, and it is the right thing to do. And we need to acknowledge the serious findings and recommendations in this report.
For families like the Blackburns, what message would you have?
Hold on, sorry.
All those DNA samples would be 4 years old by now. Are they being stored in such a way that the quality of the DNA sample has not degraded to such a point where it can no longer be viable, where it might have been 4 years ago?
I might see if Dr. Rosengreen can address that. I understand that the samples held by FSS are held indefinitely, but there's the evidence that the samples came from. They're held by police for certain periods of time. So there's different materials and different samples to talk about in that case. But again, until we go through this process, It is, we are dealing with a lot of hypotheticals. It may be that this is just one sample out of 20 other samples in which there was clear DNA evidence found, and that led to a prosecution or an acquittal. So it may not have any consequence, but we just don't know that yet. So you were going to ask about the...
In terms of families like the Blackburns, what message would you have for them in light of all this?
Oh, look, I know Sandy's case is obviously before the 2018 change in methodology, but the reality is that it was Sandy's case and the work being done from her family and Hedley Thomas that has shone a light on this, and that's good journalism. And I thank them for that. I've personally thanked the family. I do so again. I don't think this is the end of it. We will wait and see what this report shows. The Commission of Inquiry is only just starting their public hearing shortly. So we all want answers. The public deserve answers. Victims deserve answers, and that's what they're going to get through this process. Well, we put the performance data out every quarter, and I find it interesting that the LNP stand up every day with a new figure, somehow highlighting that there are pressures on the health system. We all know there is pressures on the health system. Every state and territory minister in the Commonwealth are working together on these pressures. We are working with other health stakeholders on these issues. But the LNP keep going out there, harping on their 4-point plan, which is honestly just rhetoric. If they are serious about their plan, I would love David Crisafulli to stand up and say, how much money would they put to it? How many extra FTEs would they put on, not sack, as they did last time they were in government? But importantly, how quickly would ramping be resolved with their 4-point plan? Are they honestly expecting the people of Queensland to believe that if you followed that 4-point plan, much of which is already being implemented and is already processes in place, but if you were to do that, suddenly all the problems in the health system would be fixed overnight? David Crisafulli couldn't honestly believe that. So they need to stop playing politics with this issue, because what you can do is just look across the country and see what is happening. This is not unique to Queensland. It is not unique to this government. It is a problem right across the country, and it is multifaceted, it's complex. There is no quick fix here, but we can show from the moment we came into government in 2015, we have continually invested in the health system. We have built up the workforce that was decimated by the LNP when they were in government. We have built new infrastructure when they built nothing. And we have continued to give record investment in operational funding, and now the biggest capital plan that this state has ever seen in health infrastructure. So we are getting on with it, but we know it's complex. We know there's no quick fix. And it is about time the LNP stopped playing politics with this issue and acknowledged that their 4-point plan would not result in all of these problems being fixed overnight. Don't blow away.
Once the lab comes back with a list of all of these statements that have been issued in terms of insufficient DNA and no DNA detected, does then police go and reopen all those cases?
Well, what we'll do is we work with Queensland Health to identify the number of statements and the number of samples that are in that group, and then we will prioritise those samples to send them away for further testing. So at this stage, we don't understand how many statements we're dealing with. We don't understand how many samples we're dealing with, but we're working through that to get a clear picture. And then once we understand that, we can then prioritise the sampling, and that'll be based on some scientific advice that we'll get, and also where the samples have come from.
And even last year, it was 583 samples just from sexual assault cases Will this affect it?
I can't tell you that at the moment. I think in the next couple of weeks we'll have a really good idea about how many statements we're dealing with, how many samples we're dealing with, and about how many cases we're dealing with. But at the moment, it's just we're working through the data to crunch the numbers and to understand what we've actually got.
And in June, police said that some of those samples were going back to the lab for further testing after that review was done last
Yes.
year. Have they come back and what the results are?
Some of the samples have come back, some of the sampling of the testing is still ongoing. I don't have the exact figures, but some have yielded a DNA profile and others haven't.
The police going to select
Obviously from the high end we're talking about homicides, rapes, armed robberies, sexual assaults, but not all sexual assaults. So there is quite a broad group that will be included in that, and that's why we encourage that anybody who believes that they may be a victim of crime, that they can contact the police either through the website or through the 1300 number. The number of cases we don't really know, so we could say there's going to be thousands. You know, there could be 1,000, there could be 9,000. Nobody really understands that number at the moment. So Task Force Helix is set up within our Crime and Intelligence Command, that when we get some data from Queensland Health around the number of statements and the samples involved, they will then go back and review those cases, similar to we do with cold cases, and identify, okay, this is the priority, this is the group that we really should be looking at first, and then we'll send them for test testing.
Sorry, so when police are told that there's insufficient DNA or no DNA, is it common that in that case they will go prosecution?
Well, sometimes there's other evidence available, so it's very hard to generalise. So obviously scientific evidence and DNA forms one part of a picture when we decide to prosecute. It's not the entire picture.
And do you think there are victims of crime out there who don't know they've been affected by this because maybe they weren't told that their samples didn't have enough DNA in them?
That's possible, but again, it's speculation on what actually is yielded from the samples once we send them for testing. There's no reason not to have confidence in the laboratory and the testing regime. As the Minister explained, it was the amount that was the issue, not the fact that the testing is full.
And yesterday the opposition leader claimed that there'd been murderers and rapists on the phone. Is that a fair assessment?
That's speculatory, I'd suggest.
But it hasn't, has probably affected
Worst case scenario, there could be people that are offenders that are still out there. But as I said, the DNA sampling is that there could be 50 samples taken from a crime scene. 20 of those could have yielded a result above the threshold. So we already have the DNA evidence that links an offender to a crime scene, and they could be prosecuted on that. The other samples, we don't necessarily need to do that. So it's a complex picture, and it's a complex set of data that we've got to go through to really understand what we're dealing with. That was an option that was put into our forensics database and into our Q-Prime system. When the samples were tested at Forensic Services, there was an option that we could ask for. I can't answer that question because it's up to an individual about what they do and how they react.
We're not on the experts, DNA experts, can you give us an idea on these types of thresholds? What is used around the country compared to what we've been using here?
So I can't comment about that, but there's a couple of clarifications that I'd really like to make. First of all, at no stage has there been any question raised or any finding from the Commission around the quality and the outcomes of the specimens that have been analysed and tested. The results of all of the specimens that have undergone analysis and testing, we can give the community confidence in the results of those. The Commission of Inquiry is explicitly looking at specimens where advice was provided that they do not undergo a further level of testing, and that is a small component of the total work that gets undertaken by the Forensic Scientific Services Lab. I do need to identify that the scientists that we have working in our lab, the technology that we use, the processes that we use are all world-class, fully accredited and meet all of the criteria for sample specimen testing. The question that the Commission of Inquiry is answering for us, and we are working very closely with the Commissioner, is to identify whether or not the threshold on whether or not samples had insufficient DNA to justify testing with the technology that we have is valid. It has always been the case, and it is a precedent across all of our DNA labs, that specimens are retained so that in the event that new technology becomes available over time, Queensland Police Service can and do require specimens to be retested under different forms with different technology for different purposes in labs that might be distributed anywhere around the country and occasionally even overseas. So the storage of specimens, the maintenance of the quality of those specimens is not in question, and that is a precedent that has existed for some time. And from the Department of Health perspective, we have absolute confidence in the quality of our scientists, in the quality of the technology that we use, in the accreditation of our labs that meet all of the national and international standards. And we are very closely working with the Commissioner to understand the implications of the advice that was being followed around the threshold specimens being unsuitable for undergoing further testing.
And are you aware over the last 4 years of any concerns raised within the labs to the department that the thresholds that were being used shouldn't be?
Again, we are awaiting advice from the Commission of Inquiry with regards to those specific questions. It would be unreasonable and inappropriate for me to predict those answers, but we are cooperating and working very closely with the Commissioner. The outcome of those answers and the resolution of any findings is as important to us as it is to anyone in the community.
And I know a number of victims have been affected by these studies under circumstances reports. Do you think those victims deserve an apology?
I think the Minister has already demonstrated the position of the government and also the department. And again, until we can get some findings from the Commissioner to inform us of any absolute evidence-based findings, I think we need to be very conscious of reassuring the community that our processes that we are currently undertaking are meeting all of the criteria and the requirements, and that if we do have findings made by the Commission with regards to previous testing between 2018 and June of this year, then we will absolutely work closely in partnership with Queensland Police Service and the Department of Justice and Attorney General to support any families of either victims or perpetrators where the outcome of that testing may have had a material impact on a decision that was made.
But the inquiry has made findings today that the lab is saying there's no DNA here, that in fact there could be DNA here.
So that is the only So that is the only finding that has been made. We are yet to understand whether that has had any material impact on the outcomes of any cases. It would be unreasonable for us to anticipate that. We have an enormous amount of work to do in partnership with Queensland Police Service to identify those samples, undertake analysis where that's considered necessary, and identify if there have been any circumstances where an outcome would otherwise be different as a result of that.
The Sovereign Inquiry report states that there is a chance that the chance of conviction has been lost forever. Is that not an outcome?
I can't comment on that because until we undertake the analysis of the specimens that we have available, it's impossible for us to quantify any of that risk. It is a risk. The Commissioner has identified that, and we need to understand what that risk is and undertake the testing in order to identify if that has eventuated. So that's a question that will be worked in partnership with the Queensland Police Service, who have got custodianship over all of the specimens. We certainly have capacity to increase the volume of testing through our lab, and we will provide additional resources as is necessary if Queensland Police Service require us to do that through our FSS lab. Noting, as I've already said, no question has at any stage been raised and no finding has been made around the quality of the scientists or the technology that we use to analyse the specimens when they undergo the formal testing process. So the FSS lab is adequate and available, if required, to do testing of specimens that have not previously been tested. And likewise, other jurisdictions, other states or the Commonwealth do have NATA accredited DNA analysis labs that we can work with if necessary for additional capacity to work through any tests that need to have that analysis undertaken.
Are you worried about the quality of the specimens being protected in states like
So as I've previously stated, it is a standard process that DNA specimens are stored for prolonged periods, and Queensland Police Service can, many years after a specimen has been lodged and stored, take those specimens and undertake further analysis of them. At this point in time, we have no reason for specific concern that a specimen will be degraded to the point that it would not be able to undergo testing, as is a standard and accepted practice nationally and internationally.